Have you ever heard someone say, "Heart disease runs in my family"? Maybe a father had a heart attack at 50, an uncle died suddenly, a grandmother lived on blood pressure medication for years. Many people hear these stories and immediately think, then my fate is already decided. But here's the truth. Your family history is not a life sentence. It is a warning sign. And a warning, if understood early, can save your life. Today, we'll break down what family history really means, why it matters more than most people realize, and what you can actually do to protect your heart, even if genetics are against you. Section 1. What doctors mean by family history. When doctors talk about family history, they don't mean a distant relative you barely knew. They mean first-degree relatives, parents, brothers, sisters, especially if heart disease appeared early. Early heart disease means before age 55 in men, before age 65 in women. Why is that important? Because heart disease at older ages can be lifestyle-related, diet, inactivity, or aging. But heart disease at younger ages often signals something deeper: genes. Your DNA carries instructions that control how your body handles cholesterol, how your blood clots, how your vessels function, how your blood pressure is regulated. You didn't choose these genes, you inherited them, and sometimes they make the heart more vulnerable. Section 2. The cholesterol you didn't cause. Many people believe heart disease only comes from eating too much fatty food. Not always. There's a condition called familial hypercholesterolemia. In simple terms, your body cannot properly remove bad cholesterol, LDL, from the blood. Even a slim, active person who eats healthy can still have extremely high cholesterol because their liver lacks the right receptors. So cholesterol stays in the bloodstream, and slowly it sticks to artery walls. This can begin in childhood. Yes, plaques can start forming in teenagers who feel completely fine. That's why some people suffer heart attacks in their 30s or 40s despite appearing healthy. It wasn't laziness, it wasn't diet alone, it was inherited risk. Section 3. The silent builders: high blood pressure and diabetes. Genes don't just influence cholesterol, they also affect blood pressure. Some people naturally retain more salt. Others have tighter blood vessels. Some have overactive stress hormone responses. All of these raise blood pressure. And high blood pressure is called the silent killer because you rarely feel it. No pain, no warning. Yet every day, elevated pressure damages artery walls, like water eroding a pipe. Family history also increases risk for type 2 diabetes, which damages blood vessels and nerves controlling the heart. When diabetes and high blood pressure combine, heart disease risk multiplies dramatically. Section 4. Why knowing early changes everything. Here is the most dangerous mistake people make. They only check their heart after symptoms begin: chest pain, shortness of breath, dizziness. But heart disease doesn't start with symptoms. It starts years earlier. If you have a strong family history, doctors recommend early screening: blood pressure checks, cholesterol tests, blood sugar testing, weight and waist measurement. Sometimes a simple blood test in your 20s can detect risk that would otherwise appear as a heart attack at 40. Prevention is not dramatic, it is quiet and powerful. Section 5. Genes load the gun, lifestyle pulls the trigger. Here's a phrase cardiologists often use: genes load the gun, lifestyle pulls the trigger. You may inherit the risk, but daily habits decide whether it activates. Smoking dramatically increases inherited risk. Poor sleep worsens blood pressure. Sugary diets accelerate diabetes. Physical inactivity weakens circulation. But the reverse is also true.
Exercise improves artery flexibility. Healthy eating reduces cholesterol. Weight control lowers blood pressure. Stress management protects the heart. Two siblings can share the same genes, yet live completely different heart health outcomes. Why? Because behavior matters. Section 6. What you should do if heart disease runs in your family. If you know relatives had heart disease, start now, not later. 1. Check your numbers at least once a year. Know your blood pressure, cholesterol, and blood sugar. 2. Move daily. Even 30 minutes of walking improves circulation and lowers risk. 3. Reduce salt and processed foods. Your blood vessels will thank you. 4. Avoid smoking completely. For inherited risk, smoking multiplies danger. 5. Sleep properly. Less than 6 hours a night raises heart disease risk. 6. Talk to a doctor early. Some people benefit from preventive medication long before symptoms. You're not overreacting, you're being proactive. Section 7. The most important message. Family history should not scare you, it should empower you. Because people who know their risk early often live longer than people who assume they're safe. Many heart attacks happen in people who never checked. You have an advantage: information. Your family's past is not predicting your future, it's guiding your prevention. Your heart story doesn't have to repeat theirs. Your heart beats about 100,000 times every day. It has been working for you since before you were born, without rest, without complaint. Now it's your turn to work for it. Learn your risk, act early, protect your life. If you found this helpful, please like this video so more people can learn how to protect their hearts. Share it with your family, especially someone whose parents had heart problems. Leave a comment below. Do you know your blood pressure or cholesterol numbers? And don't forget to subscribe and turn on notifications for more simple health education videos that could truly save lives. Your future heart is depending on the choices you make today.